Hello, and welcome to our final installment of Learning Curve Navigating Education Access in a Pandemic. I am Cynthia Dubose, Senior Editor for Special Projects at McClatchy. Thank you for joining us. This school year is beginning with more questions than answers. Working families are struggling to help their kids learn online. Parents are weighing the risk of sending their children into the classroom and the emotional effects of keeping them home. And districts are trying to bridge the digital divide that could leave some students behind. How should our schools, educators, and parents tackle these issues? For the past 2 weeks, our journalists have gathered local leaders, educators, mental health experts, and parents to help find answers to these questions. We hope these conversations brought you insight and value. Today, we'll host a national conversation. So let's begin. I'd like to introduce McClatchy White House correspondent Francesca Chambers, who will lead today's conversation.
Thank you, Cynthia, and thank you to all the viewers joining us today for this installment in our Learning Curve series. Today's discussions will center on best practices for safely reopening schools and put a spotlight on alternative approaches to education as parents, students, teachers, and federal officials navigate the ongoing pandemic. Today, we are pleased to begin our event with House Education and Labor Committee Chairman Bobby Scott, a Democrat who represents Virginia's 3rd Congressional District. Congressman Scott has served in the House of Representatives since 1993. Prior to serving as chairman of the House's Education Committee, he was the ranking member of the committee from 2015 to 2018. We had planned for Representative Mark Walker, a Republican on the committee, to take part in this conversation as well, but he's unable to make it due to a scheduling conflict. So Congressman Scott, we are so pleased that you could make it today as summer recess comes to a close and lawmakers prepare to return to Washington to hopefully wrap up federal spending negotiations.
Well, thank you, Francesca. It's good to be with you.
I'll be speaking later in the program, Congressman, with officials at some of the leading education associations about their advocacy to Congress for emergency funding for schools. But those requests are predicated entirely on the House and Senate's ability to come to an agreement on an economic recovery package. Congressman, COVID-19 has disproportionately impacted communities of color in a number of ways, one of them being education. How can government, federally and at the state and local level, help to address these inequities?
Well, first, we have to recognize that we need to reopen the schools. The academics are much better. Students do much better academically if they have in-person instruction. And that's particularly true in trying to close the achievement gap. Those at the bottom are disproportionately adversely affected. Children get better nutrition by having access to school meals. The social and emotional maturity is gained by being in the schools. And we can identify child abuse. If the students are coming to school, we can identify child abuse. And quite frankly, if you don't open the schools, you're not going to be able to reopen the economy. So we really need to reopen the schools. The problem is you have to have a plan. You can only reopen the schools if it can be done safely. And the safety doesn't happen by accident. There are a lot of costs involved in reopening the schools safely. You have to have PPE. You have to have sanitation and disinfectant and staff to do the disinfecting. You have to have staff to and money to reconfigure the classroom to accommodate social distancing. There'll be additional transportation costs because if you have fewer students on the bus, you're going to need more bus trips. The medical services, if a student is showing some kind of symptoms, you need nurses to make a diagnosis. Is this runny nose or is this COVID-19? And we need ventilation, proper ventilation in the schools. We know that restaurants, at a restaurant, it's safer to be outside than inside. And that's because as people breathe, the virus gets in the air and everybody's breathing it. But if you have proper ventilation, you have a lot less problems. We had a study by GAO that was released about a couple of months ago that showed that 40% of the school districts have problems with more than half of their HVAC systems, heating, ventilation, and air conditioning systems. More than half of their school districts need help. And so we need resources to make sure our schools can open safely. And without those resources, it's hard to imagine how you can have a plan to reopen the schools safely. And frankly, reopen the schools or I will cut your funding. That's not a plan. We need plans, but most of all, we need resources.
And Congressman, we'll come back to a few of those issues here in a minute, but I want to stay on the funding for a moment because House Democrats are offering Republicans in the Trump administration $2.2 trillion at this point, a stripped down version of the $3 trillion in the House passed legislation you referred to. So what's being cut from the House bill, and are any of those cuts tied to education?
Well, if you're looking at a budget, just looking at education, you can't look at the education portion of the budget without first looking at what is happening to funding for state and local governments. At the present trajectory, present projections, state and local governments will have about $1 trillion in revenue shortfalls. If education takes its proportional hit, you're talking about $300 billion cuts to education. We know these are real. 900,000 public school officials have already lost their jobs. We're looking at probably 500,000 more losing their jobs. And so the first thing you have to look at is the fact that in the Democratic plan, the HEROES Act, there's about $1 trillion in state and local funding, enough to avoid all cuts to education. That's the first thing you have to look at. In addition to that, we have additional funding for education, $58 billion for K through 12. But just as important, in the moving forward infrastructure bill, we provide $130 billion for school construction as part of that infrastructure bill. And that's where you can get money to fix your ventilation systems. That's on top of what we do for state and local. If you compare that to the Republican plan, first looking at what's happening to state and local, nothing. So you start off 300 billion behind. They put in 100 billion, 105 billion for education, some for higher education, some for other stuff, but that doesn't even cover half the projected cuts. And so you can't look at what's going on in these funding bills without first looking at what you're doing for state and local. We can squeeze in what's going on in the HEROES Act by cutting back the time, by eliminating some of the programs that would be desirable. And if you have to negotiate, some of the healthcare provisions appear to be in jeopardy. But the funding for education starts off with funding state and local governments so they don't get cut. Then everything else is a step forward. In evaluating what the Republicans want to do, I don't know how they justify any part of their budget with nothing for state and local, because their allocation for state and local, like I said, doesn't cover half the cuts.
Well, Congressman, talk to me about why you want to invest more in technology like internet hotspots and paying school personnel. Why do you consider those to be top education priorities?
Well, most of the provisions in the HEROES Act are money that the localities will decide where it goes, but there's obviously a need for broadband. When you're doing distance learning, you cannot do distance learning without connectivity. A lot of school divisions have concluded that every student needs an individual device, a laptop or some device, and connectivity. If it's not connected to something, it doesn't do you much good. A lot of, for the few students that don't have this, and some it's few, some it's a lot. But if a student doesn't have that, and in Virginia, we're spending about $12,000 per student on education, state and local. If they don't have a device, they get zero educational benefit. So for a $250 to $300 device, and we're negotiating internet connectivity at a $10 a month basis, for a couple $100, they're right on par with everybody else. Instead of zero education, they're getting the same education as everybody else. That costs money. Not a lot of money compared to what you're spending, but it costs money. And without that, you're just not getting an education. And the achievement gap, one of the measures is what's happening with low-income students. Low-income students are obviously most at risk for not having a computer and not being connected. So the achievement gap for low-income students will be exacerbated unless you spend a little money making sure they're connected with a device.
Well, Congressman, even if a relief bill were to pass, it would take some time for that money to make its way to schools. So what is your advice to states and K through 12 educators about allocating resources in the meantime from a safety standpoint, but also from an educational and an instructional standpoint so that disadvantaged students don't fall behind?
Well, we passed the HEROES Act in May when there was plenty of time to plan. You had plenty of time for construction, to fix your ventilation systems. There was plenty of time to do that. Now some schools have already opened, and so obviously you have a problem. The House has done everything it can do to get the resources available. If the school systems know they have the money coming, and then the money is committed, but might not be there for a couple of months, they can kind of rearrange the money they have, spend money that would have been spent in January. You can spend that now in anticipation of getting money that can cover the You could maneuver your budget if you know the money is definitely coming. So our job now is to try to get the appropriations done. But like I said, unless you do something for state and local government, the school systems are just looking at massive cuts. And I don't know how are you going to have schools opening when everybody knows that you need more resources. How are you going to be able to safely open schools with less money? That's why the HEROES Act needs to pass, so that the first of all, the state and local government money will be there, so they won't be facing cuts, and then the additional money to cover the things that need to be done in the classroom, transportation, the ventilation systems are important. Without proper ventilation, if 40% of the school districts have half their school systems, half their public schools in disrepair on ventilation, the 40% can't open half the schools without resources. And if they had the money, they would have fixed them a long time ago. They need additional money, and that money can be found in the Moving Forward Act, the infrastructure bill.
Well, what role do you see, Congressman, for parents in this process? How can they help, and what's your advice to them? Well,
they need to call their U.S. senators, particularly on the Republican side, who are holding the bill up. It's unclear right now whether they have the votes to pass anything. Some have suggested that they want to press the pause button, just stop, do nothing. You'll have to ask them what they expect school systems to do in face of hundreds of billions of dollars, or almost $1 trillion state and local in cuts coming. A lot of it's going to hit education. Local only has education, public safety, and sanitation. That covers most of their budget. If you try to hold education, if you try to protect education, you have to double up on the cuts on public safety and sanitation. You can't. Everything has to suffer a proportionate cut. And with the resources, you just cannot safely open the schools.
Well, bottom line, Congressman, and we'll end with this today. Once Congress returns into session, there's really only 3 weeks before another long recess. Do you think that schools will get this money before then?
That's up to the U.S. Senate. We have proposed a bill. They're stuck at $1 trillion. If they stay there, that's enough to cover state and local, and nothing else. No health care, no benefits, no unemployment benefits, no education, no nothing. You need that just to cover state and local. And so that's not really much of a negotiation. We have so much need. We've been able to get through with particularly with the CARES Act that had a lot of support The economy did not collapse because people, even though they had lost their jobs, had the additional $600 so that they could continue paying their bills. The nutrition initiatives really relieved a lot of childhood hunger. Didn't eliminate it, but it did a lot to reduce it. There are a lot of things in the CARES Act. It went a long way, but that's expiring. We now need to go forward, improve the funding so that our schools can open safely. And if we don't have the resources, it's just going to be a total mess.
Well, Congressman, unfortunately, we'll have to leave it there. I wish we had more time, but we'll be watching those negotiations closely here at McClatchy, and we thank you for spending this afternoon with us.
Good, thank you.
And now I'm joined by our first panel for a conversation about supporting schools and families during the coronavirus. Lori Combe is president of the National Association of School Nurses. For 25 years, she served as a school nurse on intermediate and high school campuses in a school district in Texas. Jose Vilson is a math educator for a middle school in the Inwood, Washington Heights neighborhood of New York City. He graduated with a bachelor's degree in computer science from Syracuse University and with a master's degree in mathematics education from City College of New York. He's also a committed writer, activist, web designer, and father. Kiana Thomason is the president and CEO of Health Forward Foundation in Kansas City, Missouri. She has dedicated her career to the improvement of health and wellness across the region, with a focus on communities with significant health disparities and those living in marginalized conditions. Anna King is the president-elect of the National Parent-Teacher Association. She has more than 20 years of leadership experience at all levels of the PTA, including at the state level, where she served as Oklahoma State PTA president. King is also on the board of the Douglas Law and Public Safety Academy and a co-leader of the Moms Demand Action Northeast chapter. She is married with 3 children and 9 grandchildren. Thank you all for joining us today. To avoid any confusion in this remote environment, I'll call on each of you by your name when it's your turn to speak. Lori, I want to start with you. Your organization estimates that just 39% of schools have a nurse on site full time, while 25% of schools have no nurse at all. We're seeing school districts without a nurse move to hire one for the coming school year. And how can parents and educators at schools that do not have a full-time nurse help to prevent symptomatic and asymptomatic spread of coronavirus?
I think that's a great challenge for school districts who don't have a school nurse to manage COVID-19. When we think about the way that a school nurse would manage that, they would conduct a nursing assessment, determine if the symptom was potentially related to COVID-19 or if it was related to another existing health condition that the school nurse has an intervention to assist. So I think that when there's not a school nurse, certainly more children will be sent home and away from that instruction that we know is so vital for them.
Anna, is this a concern for parents that schools reopening for in-classroom learning may not have a health professional on site?
Oh, absolutely. Parents are questioning the safety of returning to school in person and want safety measures in place. Many of our parents are saying that they would opt for all remote learning if given the choice. Earlier school opens have caused really big concerns for parents. Our parents want to know if there are certain precautions in place like masks, social distancing, temperature checks, plexiglass, extra cleaning, plans when people are exposed, testing positive of COVID-19, and other parents just want to wait for a vaccine to be available for children to return to school in person.
Jose, how has that remote learning environment impacted communities of color and special needs students? And what lessons have you learned so far during the pandemic about how to best educate students who respond better to in-person learning at a time when that just hasn't been possible in some areas?
I think so many of the concerns that we have put to the fore, whether it has to do with distance learning, remote learning, even the hybrid and blended models that are out there these days, has still breed inequity. We recognize that we haven't yet dealt with so many of the structural inequities that happened pre-COVID. So we were stuck in a situation from March onward where we were just trying to fly the plane while building it without knowing which direction it was actually going in. So these levels of inequity harm even those of us who are most marginalized, those of us who are Black, brown, even our Native American populations, anyone who didn't have access to Wi-Fi, broadband. And so oftentimes there's a lot of conversation about making sure that distance learning is more equitable. And we still have yet to have a discussion where we try to make sure that our structures that we currently have are addressing our special needs students, our students who are multilingual learners, or anyone who is outside of the periphery, what we consider normal. So to that end, it's been really difficult as a classroom educator who prides himself on teaching each and every student. But I've also found ways to make sure that my own schedule is flexible so I can address their needs as best as possible. But understanding too that none of this, I guess, finding all these little rectangles on my screen is the same as actually having a face-to-face interaction with somebody who so desperately needs it from the folks who are trying to learn.
Well, Kiana, there are so many parents who are eager for school buildings to reopen, but how can schools reopen with limited resources and do so safely? And what is your advice to parents and educators about tackling those challenges?
Well, my advice probably is more broadly to communities and recognizing that this is not just a problem for parents or teachers or families and schools. This is a community problem that we need to come together to pool our resources from a collective impact standpoint and use the construct of metro financing to begin to solve some of these problems at a local level. We can't wait on the government to come in and solve all these problems as we all hoped that they would. But considering the complexities that Jose mentioned, the social inequities that existed pre-COVID, they've all been exacerbated by COVID. So food insecurity, when kids were released in the spring, many parents did not plan and cannot afford to feed their kids 3 times a day. The eviction concerns, and we know that there's an executive order at play right now to extend that into the end of the year. However, that has a lot of ambiguity and is subject to interpretation between landlords and tenants, and we all know how that will probably play out. Kids have been exposed to their abusers since school let out in the spring with no respite and recourse, where school was often a safe haven. Kids have been traumatized by seeing Black men murdered all year long on TV. So there's an abundance of trauma, as well as with parents as well, in having to navigate the new financial hardships where they were already struggling. And so the question for us as a community is, how do we collectively provide psychological PPE for students, for parents, for teachers, and for our community? And so I think we do that by thinking about the resources, as Representative Bobby Scott mentioned earlier, that are critical. I think broadband needs to be viewed as a public utility at the federal level. The Federal Communications Commission has an opportunity ahead of them to not only address this for education, but also for telemedicine. As we know, these families also have access to care challenges with respect to healthcare. And we also know that there's a role for philanthropy to play. So Health Forward is certainly leaning into this in our community right here in Kansas City to understand how can philanthropy help support government and how can business and nonprofit be a part of stabilizing families and children who are just struggling.
And I want to come back to you in a little bit on both the mental health issues and food insecurity. But for now, Lori, I do want to get your assessment on coronavirus testing in schools. The federal government has indicated that it could distribute rapid coronavirus tests to some schools this year. The Health and Human Services Department says that trained operators, in addition to medical personnel, can easily administer these tests. Even if schools had access to coronavirus testing, though, do most have the infrastructure to conduct it?
I think testing is an important part of our understanding of the burden of disease in schools. And so for that reason, I would be in favor of a rapid test. But the infrastructure is a critical component that is missing. if we think about how the many ways we have to manage health in school, students who have always needed a touch point in the school clinic for medications or treatments, they'll be at school and they will need support in an area that keeps them separate from children who might be symptomatic for COVID. We'll also need personnel to manage those students that the school nurse believes are symptomatic for COVID and need to be isolated. Those children will need supervision. The school nurse will be busy screening the many children that teachers are referring to the school clinic, because teachers who may have previously told a child who had a headache to get some water and rest their head for a few minutes and rejoin the class are going to be reluctant to keep that child in class, and they should be. They should be able to have a school nurse to send that child to. So I think the picture I paint for you is that the personnel responsible for health in the school are going to be stretched very thin. So will they have the capacity to additionally add on a testing strategy? I might also add that in many school districts, the health personnel, the school nurse, is also tasked with contact tracing. So the funding that Representative Scott talked about is essential for adding personnel to schools to manage this situation.
Jose, in New York, schools were scheduled to reopen for in-person learning next week, but that's now been delayed. The city has announced plans to test a random sampling of students and staff on site with their consent, and it's requiring schools be stocked with 30 days of PPE at all times. Is that enough to ensure safe reopenings of schools? And if not, what additional steps do you believe are necessary to keep educators and students safe?
I would say absolutely not. I think there is a big trust gap between those of us who understand the science versus those of us who understand the structures. So understanding that, yes, we are at a point where citywide, we are at a threshold where it is permissible for us to actually open schools fully. But then understanding too that there are many schools who haven't even received the PPE, that haven't actually don't have a nurse on campus, that we haven't had the conversation between all the adults involved to make sure that every single child is fully prepared, both from a mental standpoint as well as a physical standpoint, to actually come into classrooms. Even in my own neighborhood of Washington Heights, we recognize that out of the 38 schools that were tested for ventilation, 36 were not fully prepared for that. We know across the city, we have any number of classrooms that don't have any windows whatsoever. And so recognizing that and understanding all the structural inequities that were already in place, we have to find a way to say we have to delay schools in a proper way. It can't be 10 days. It has to be a way where we think about every single child according to category, according to neighborhood. We have neighborhoods, whether it be East Harlem, El Barrio, where I live, or Washington Heights, or places in Brooklyn, where the threshold is way above that 1% threshold that has been so touted by government officials. We have to be very conscious too that, once we start allowing kids in, that means the transit that wasn't transmitting as much, COVID-19 is now going to have more bodies involved. And there is going to be this element of with permission. There's going to be a lot of students who may not want to wear masks. And, me as a classroom teacher, I'm always nervous about kids even trading pencils and pens and asking people for other things. And kids are going to want to naturally gather and socialize. They're not going to want to just stay in their seats. And there's maybe only 10 to 12 seats in an array in the classroom. And so the things that we would normally be accustomed to in a general classroom aren't permissible according to epidemiologists' recommendations. So in the way that we're going to have to really reshift everything we think about when it comes to the classroom dynamic and the school dynamic and the community dynamic is going to be really difficult to plan. And I'm noticing too that all across the city, principals are consistently changing their plans day to day, as are parents who have become more and more leery of this conversation around COVID. And so they're pulling their children out from the hybrid model to just staying all remote until the coasts are clear. So those are things that we still need to negotiate and still need to have a conversation about. But opening up in 10 days is probably not the best move right now.
Well, Anna, do the parents that you're speaking with across the nation want schools conducting coronavirus testing? Is that something that would make them feel more comfortable about returning to in-person instruction?
That would be extremely helpful if that can happen. National PTA has been calling on Congress to provide a robust and financial investment in our teachers and our students. Just listening to everybody on this panel talking about the inequities. There's a teacher concerned and talking about the inequities, and you heard the Congressman Scott talk about the infrastructure. Testing is important, and when we talk about putting our children inside of buildings, it's the utmost priority during this time that our children are safe and healthy. And not only our children, but our educators and our staffs and our families. It's critical that our students return back to school. We all know that, but it has to be the safest way possible. There cannot be a one-size-fits-all because all of our districts are totally different.
Kiana, you mentioned mental health before. The mental health of students is a critical factor in the debate over whether to reopen schools this fall or continue remote learning or take a hybrid approach to educating. What effect has keeping kids at home had on their mental health, and what can parents and educators do to support children's emotional development in remote learning environments?
Well, as I mentioned earlier, there's a cauldron of socioeconomic complexity. So we've seen increased hunger in families and in kids at home. We've seen increased exposure to abusers. We've seen crazy levels of isolation where kids are disconnected from their peer group and are not able to engage. And we know that human interaction is an essential need for us. And so I think whether it's distance learning or whether it's in-person learning, I think school districts and communities need to ask, how can we provide trauma-informed and culturally resonant education and care, wraparound services to the children, families, and educators, as Anna mentioned, is of paramount importance. And I think from a trauma-informed perspective and from an equity perspective, every school might not need to get the exact same thing. I don't think cookie cutter approaches are the best here. So let's look at the data about our schools and the demographic that is represented in the schools and apply some assumptions with respect to socioeconomic hardship. And so new resources around school social workers, around therapists, not only for the youth, but also for the educators is also important. So I think we have to reintegrate into our new during COVID, post-COVID period in a very trauma-informed and culturally resonant and equitable way.
Lori, a reader asked this health-related question that I think you would be the best to answer. Would you recommend that masks be required at every age level? And the same reader asked, how can you handle transportation so that kids and drivers stay safe?
So let's talk about the masks first. I think that generally speaking, that schools should require masks for students, but we also need to understand that one size does not fit all. There will be certain students who are unable to tolerate a mask because of a particular diagnosis or a developmental condition that they have. And so I think that parents and providers and school personnel need to work collaboratively to understand which students are able to wear masks and which students need to be protected in some other way. And then remind me of the second portion of your question, Francesca.
A reader had wanted to know about transportation and how students and students and personnel can stay safe.
So in transportation, I think again that masking is important during that bus ride. If we follow the physical distancing protocols, a normal school bus can carry maybe 17 to 20 students as opposed to the 60 to 80 they might have carried before. That speaks to Representative Scott's indication that we need more funding for transportation. I also think that as weather allows, the windows on that bus ought to be open to allow for proper ventilation in that school bus and adequate air exchange.
Okay, and Jose, I'd actually like to share a reader question with you as well and get your reaction. Most school districts phasing in face-to-face instruction are starting with the youngest students in order to support early learning initiatives. How can school districts prepare for educational gaps of these young students that have already missed months of supportive instruction and may continue to miss important academic and social development milestones when school is brought back face-to-face?
I think that's a difficult question. That has to go parent to parent because of the way that our structure, our society has been structured. We understand that so many of the choices right now are being made individually, but there has to be a collective mindset around some of this. What I notice about what's happening now with pandemic pods, for example, is that so much of the conversation is centered around middle class to upper class white parents who are able to have the privilege of, paying an adult to give their specific child or their 3 to 5 children the proper care that they deserve, I suppose. But then we don't have a public option for our most vulnerable children, our children who are more likely to have parents who are essential workers, for example. And so what I've noticed in New York City is that we do have this thing called the regional enrichment centers, which has been critical to assuring that folks like police officers and firefighters and any number of essential workers are able to send their child to school during a pandemic. Those of us who are not essential workers can also try to find ways to maybe collect a couple of students and ensure that we open up any number of opportunities for kids to learn amongst their peers. Now, what that also is going to mean, though, is that we're going to need to be very thoughtful about how we do testing, how we ensure that students are able to get that learning in some way, shape, or form. We're going to have to do better as far as digital learning is concerned. Make sure that broadband is a public option that everyone can take advantage of and that all our laptops are updated to the best of their abilities. But we're also recognizing, too, that a pandemic doesn't really it plays no favorites, right? It only goes with whatever's happening around that surrounding neighborhood. And unfortunately, because of the nature of what we call it an essential worker, it hit so many of our blackest and brownest folks, our most vulnerable populations. So something to consider for so many of us who are trying to look for that other option is, yes, we probably could open the school safely, but we got to find a way to do it.
And Anna, I want to conclude with you today. Are parents being included enough in the decision about whether to reopen schools? What are you hearing?
So, not 100% across the country. In some of our districts, they're being able to sit at the table and have these tough conversations about the safety of their children returning back to school. And many are not. Many districts are still deciding they feel like they know what's best for the children and not including the voices, and not even including not just the parents' voices, but some of the teachers. Before we leave, I want you to think about kids. So many of our kids right now across the country are back in school. That's including my district. And my district is 90% of students that come from low-income families, right? And they have federal funds that have been used and have been extremely essential for acquiring technology, because for the first 9 weeks, they have decided to go remotely. And this district that I live in, it was a priority to have town hall meetings and have discussions with the parents in the community to talk about what can we do together as a team to make sure that our children are successful and safe. When you look at the social media, you see our children that are returning back to school. When we're talking about inequities, we're talking about kids that are sitting in Taco Bell parking lots, outside of a bookstore, outside of Starbucks, or even outside of their own schools to get internet to do their schoolwork. That's the inequities that's been showing up all across the country, and Congress has to get their act together. They have to put funding. They want our students to be equipped and ready for the social life, but there are inequities. And when you don't include a parent voice at the table, you're missing a discussion. Because when the students are not in the schools, they're at home. So who better can help move this forward and bring great ideas, except for the parents? The parents are essential when we're having these discussions when it's regarding our children.
Well, thank you all today. We appreciate having you here. We're going to have to move on now to our second and our final panel, where we will discuss the best practices in schools on those limited financial resources that so many of you spoke about today. I'm pleased to welcome to the conversation Donna Harris-Akins, Senior Director of the NEA's Education Policy and Practice, and the School Superintendents Association's Executive Director, Daniel Dominic. Donna is the Director of Education Policy and Practice Department, as I noted, and prior to joining NEA, she served as the Policy Manager for Service Employees International Union's Public Services Division. Daniel is the Executive Director of AASA, the School Superintendents Association, and has more than 36 years of experience in public education, including 27 years as a school superintendent. Thank you both for joining us today, and I'd like to begin by talking about those funding requests that your organizations have also made to Congress for emergency relief for schools during the pandemic. Donna, the NEA was part of a group of educational organizations that requested $250 billion from Congress. That amount includes requests for higher education as well as elementary and secondary education. But what are the costs that emergency funding would cover? And what wouldn't educational institutions be able to do if they don't get the money they're asking for from Congress?
Thank you, Francesca, and thank you for having us today. So I think I would start with the thing that is front and center for us all, and that is keeping students and educators and families safe and healthy. So other panelists have talked about PPE. There's also making sure that there's enough disinfectant, enough staff to make sure that the schools remain clean. Make sure that you have food service workers who can feed the kids, and that's whether they are in the building or whether they are at home. You also need to make sure that there are enough staff who are addressing the mental health support that students will need, and quite frankly, that educators will need in this time. Many students and many families have experienced the loss of a loved one during this pandemic. There are many families who are impacted by the racial injustice that is televised just about every day in this country. There are other families who were feeling the impact of the injustice long before the pandemic ever hit. They are in communities who were under-resourced. They don't have housing. They don't have enough food. The joblessness rates are too high because there aren't enough jobs in their communities for them. And so when you think about the money, you have to think about the people, quite frankly, first, and what the students actually need. And so working with families, working with educators, working with community leaders, we're hearing all the time about the deficit in the communities that used to be there. We need support for families at this point. Inside of schools, public schools and on campuses, we need support for students and for educators. So if we make sure that there's enough food, that there is housing, that families have jobs, that everyone has access to health care, when there is a vaccine, that it is widely available. But more importantly, or more precisely in the schools, it is all about what a student needs at this point. A lot of schools are working on a hybrid schedule or attempting to. Many of them are virtual, and thinking about the technology needs in and of itself, that need is huge. And schools have to retrofit in some cases to make sure that they can provide that kind of virtual learning so that every student has access to the best kind of virtual learning possible. You need to make sure that there's professional development for the educators, making sure that there is support for families so that they understand the virtual learning that needs to take place, and for students, making time in the schedule so everyone gets acclimated to that kind of environment because it is different, and trying to make sure that it is much better than it was in the spring, where everyone was doing the best they could under an emergency environment, but we're now in the fall. And so people are learning different things. They are trying different things. They want to make sure educators want to make sure they're engaging with their students in meaningful ways. And you heard the previous panelists talking about engaging with them. Even though you're in a virtual environment, you still need to connect with your students one-on-one in order to make sure that they are comfortable in learning moving forward.
Well, Dan, I want to put a similar question to you as I put to Congressman Scott earlier. Congress is essentially at a stalemate in its negotiations and will have just 3 weeks to pass a bill before lawmakers return to their districts until November. So even if they are able to pass legislation during this month's work period in Washington, it will take time to distribute those funds to schools. What are you advising school administrators to do in the interim?
Well, we're very disappointed that Congress was not able to act timely. Certainly long before schools began opening their doors or going to virtual learning as the majority of schools have done. We just did our most recent survey of our superintendents shows that about 56% of our school districts are using the hybrid model in terms of having some students in school and some students learning from home. About 32% are doing it virtually altogether, and only about 11% are doing it in person. But even those districts are beginning to see the problems that they have as infections occur very soon after they open their doors. So the reality is that without the funding, a lot of the schools that would have attempted to bring children into school have had to go virtual simply because they are lacking the monies that they needed to ensure that it was safe to open schools, as we've heard from the previous panels. The spacing requirements, the transportation requirements, the nurses, the protective equipment, all of these things that are needed. One of the critical issues, though, that requires a lot of money and has not been addressed at all as it should have been, is the lack of technology. 11 to 14 million children today are still lacking the computers that they would need to participate in remote learning. And almost as many live in homes that do not have internet access. So we're talking about a significant number of our children that in a remote learning situation will not be able to participate because of the lack of technology or the lack of internet access. Now, schools are bending over backwards. Our teachers are doing a terrific job. Everybody is doing everything that they can. I've been talking to our executives in rural areas where there is no internet access, whether you have the technology or not. They just don't get internet. In those areas, the schools are going back to the old-fashioned way of developing. The teachers are developing paper and pencil packets that are delivered and taken to the homes of these children. The issue of feeding so many of our youngsters who are so happy and thankful that finally the Department of Agriculture is willing to extend the program at least through this first semester so that schools can continue to feed the children. So there are so many areas of need, and districts, unfortunately, without the funding and having already suffered significant education cuts because of the economy, are scraping and doing everything they can to do all that they can for all of their children, given all of these issues and all of these problems that are facing them.
Donna, many parents are asking for coaching advice on how to assist their children in an online learning environment. Some of them have more than one child in separate grades who they're trying to educate on top of their jobs. What advice does NEA have for caregivers?
So the first advice is make sure your voices are heard. We heard that in the previous panel. Many districts are doing a great job. Many superintendents are doing a great job of listening, not just to educators, but to parents and families, and quite frankly, to students about what they need in this time and environment. But if you're not being invited to those conversations, do not wait for the invitation. Tell them what you need. Tell them what you want. As you heard, there are some districts who are navigating this together with other stakeholders. They are opening the larger parts of the school buildings if they have that space, the gyms, the auditoriums, particularly in districts where the schools will not be open face-to-face for everyone. They are inviting those students whose families are essential workers or whose parents are essential workers into the school so that they can do their virtual learning in the actual physical school building. But because that number is so much lower, they can physically and safely distance the students. And the students are actually accessing the virtual learning just like their colleagues. Other things that can happen are, open and honest communication with your students' educators, with their teachers, to let them know what times of day your family cannot be or your student cannot be on. If it's in a virtual environment, what times of day they can be on. And most districts that are engaging with virtual learning are figuring out how to schedule so that there is not only time for students to be online face-to-face with their teachers or online one-to-one with their teachers, but also times when there are what they're calling office hours, so that it is not during the regular school day, but there are times when students can access their teachers or family members can access those teachers to talk about the challenges, talk about what can be done, and talk about the kinds of supports that are necessary. But the first thing I would say, and the most important thing I would say, as we all try to figure this out, is open and honest communication, because that's the only way that we get to a point where students actually get what they need.
Dan, a number of readers have been asking whether masks will be required in schools when they reopen. What have you been recommending to school superintendents?
Well, we definitely have recommended from the beginning that the CDC, the initial guidelines that the CDC put out, be followed, specifically the spacing issue and the face mask. It is and we see it is the safest way to prevent infection from happening and spreading. So we recommend it, but at the same time, we recognize how difficult it is, how difficult it's going to be to have, for example, kindergarten, first, second graders wearing a mask all day. Even for the older children, it's going to be difficult, but it's necessary, and it almost becomes an education process. I think we've all grown accustomed to the wearing of a mask, as uncomfortable and as awkward as it was at the beginning, but we're getting used to it. We're going to have to do the same thing with the children. We've already seen where we saw on television these pictures of high schools opening without social spacing and masks, what happened shortly thereafter. A significant number of infections spreading throughout the school and spreading throughout the community. It's the safe thing to do, and it's the right thing to do.
Donna, coming back to this question of coronavirus testing in schools, is testing in schools as a requirement to attend school something that teachers are advocating for? Would that make them feel more comfortable about returning to the classroom?
Absolutely. And I should say, this is not, as you know, not just an education issue. It's a community issue. So particularly in spaces where the infection rates or the community spread has not been contained, testing everyone before they come back in the building is absolutely essential. And we would argue that if the spread has not been contained, you should not be reopening the school building. You should not be reopening campuses, because the first and primary thing that has to happen in order for people to stay safe is to make sure that the rates and the infection rates and spread are actually contained in that particular community. If they are not, the school building should not be open. And it is not, we would agree that it is not the best kind of education for students to get when they are in a fully virtual environment. But quite frankly, health and safety has to take precedence here. So if communities have not contained the spread, school buildings should not be open, and we should be following health experts' advice in those particular communities about when it is actually safe to reopen the school buildings. When that happens, educators and families and students can work together to make sure that it is done in a safe way. But it is absolutely essential that we pay attention to the health experts, the infectious disease experts at this point, so that we all actually make it to the other side of this pandemic and make sure that schools are better than they were before they closed.
And before we go today, Dan, I want to talk to you about feeding kids during the coronavirus. A number of people brought up the food insecurity issue today. Those kids who would otherwise have regular access to free meals at school haven't been able to get them during the pandemic at times. What can schools do to reduce the disruption of meals while students are at home?
Well, what a lot of the schools have done, and again, we appreciate the fact that there has been an extension of the meals program through this semester, and that's great because that was a major issue for us to make sure that food was available. But what a lot of the school districts are doing is that the bus drivers and the buses are delivering the food to the homes of children in many cases. And in other cases, of course, they make it available at the school site for parents to be able to go get them. But having the food is the first thing, and I'm glad to see that that's going to continue to happen. Distributing the food, districts are doing everything they can to make sure that that happens as well. So that's a positive, and we're very, very happy that that's happened.
Well, that concludes our program for today. Thank you for joining us on behalf of McClatchy for this important discussion. We'll continue to engage on this issue, and we hope that you will too. Until then, stay safe and enjoy your holiday weekend.